Hi, welcome. My name is Unity Stokes, co-founder at Startup Health. Today, I have the pleasure of speaking with health transformer extraordinaire Emily Sylvester from Mother of Fact. We're going to be talking about the best nutrition care for mom and baby. So stick around to learn what Mother of Fact is bringing to the world.
Crazy.
Welcome, Emily. How are you?
I'm doing well. How are you?
I'm great. I'm so happy I get to speak with you today and talk about everything you're doing at Mother of Fact. It's been a while, and I've long wanted to do this and really share your vision with the world because I think the area of focus and innovation that you've been dedicated to is one that doesn't get enough attention and is one that we need more of a spotlight on. So thank you
Thank
for taking the time. What's new in your world? Maybe we start with learning how you describe Mother of Fact and what your vision and mission is for Mother of Fact.
Yeah, absolutely. So glad to be here today. I'm founder and CEO of Mother of Fact. I'm a mom of four, one of whom is behind me right now wearing her startup health onesie. So we'll see how this goes today. And as a registered dietitian and board certified lactation consultant, I wanted to make sure and grow nutrition as a standard part of women's health, specifically maternal health. And I think when I joined Startup Health back in 2021, I want to say, don't quote me on that. I had just launched, it was then called Nurture Talk, as a service to support families in infant feeding and late pregnancy, recognizing that increasing support in breastfeeding and nutrition in late pregnancy had extreme effects on not only cost savings for health systems and payers, but making sure that those outcomes of pregnancy and the first 1,000 days were improved through one of the easiest to move needles, nutrition. And through that, really learned that our outcomes were great. Moms were engaging with our service. Unity, it was me texting with moms like 24/7 for the first year and a half to show this as an engageable and a scalable service before I even went in and raised any money or gained partners. And through that, just realizing that moms were still coming to us when it was kind of a little bit late. We were picking up the pieces of things that could have been preventable. And over the last couple of years have really nurtured Mother of Fact to be a service where we can partner with clinical organizations and birthing people from the time they start thinking about having a baby, bringing in nutrition to the forefront in empowering that pregnancy and family planning journey. And not only that, but making it so there is a return on investment or elevating what healthcare systems are getting out of that process as well to bring it to more vulnerable families.
I love that. So you're really focusing upstream on even before a baby's born. And I think that's so important. And I want to learn about something you said, the first 1,000 days. Where does that first 1,000 days begin then in how you think about that in terms of nutrition, I guess, or the needs that we should all be thinking about and that you're the solution you're bringing to families and clinics?
Yeah, so Mother of Fact right now is delivering a digital first service that brings dietitian care into the homes of families and healthcare systems that's reimbursable, culturally tailored, but built right into OB flows or obstetrician or midwife or those women's health clinic workflows to say that nutrition can be highlighted. We can do it at scale without you having to lift a finger, and your parents and patients are empowered through that process because of our app that we have the users use. And the only way that users can get on now is through a referral through a healthcare system or an organization that are serving these patient populations intentionally because of what you asked. How are we coming into those first 1,000 days? And it's coming in as early as possibly, as seamlessly into the clinical experience of planning to have a baby, of going through prenatal and postpartum care so that we can be there every step of the way because we know nutrition can be low lift and it can move the needle, but everybody eats. And eating healthy or finding the right foods in a budget is really hard sometimes. And so we come in and not only do that one time, we're not one dietitian referral, we're not one dietitian visit. We are living on these families' phones through the entirety of that journey so that when it comes down to those decisions of I'm at risk of gestational diabetes or I'm at risk of high blood pressure, I know I should be eating these foods, but my WIC check doesn't come in until next month and I don't know what kind of beans to buy for high fiber. Our dietitians are there through that entire journey, and we're there in a way that's affordable and recognizable within that clinical journey. So that information is also getting back to those providers and empowering them in their journey because those of us that work in women's health, we know there's an OBGYN shortage. We know that maternal care deserts are only growing, and we know that patient populations that speak different languages and have different needs are only growing, on top of the fact that at minimum 50% of these pregnant populations are showing some type of nutrition risk. That puts a lot of burden on these rural healthcare systems or healthcare systems that have a safety catch net of different patient populations.
Well, there's so much to unpack here, and I'm so excited we're getting to this because there's national need here, really global need, but I don't know, you're sounds like you're focused on US first right now. Is it the type of thing that you hope to make in all 50 states and through multiple systems and multiple clinics so that everyone gets access to this? You mentioned rural communities. You mentioned another magic word, which is reimbursable and affordable. And I want to unpack those things because I think what you're doing is so important here. It's clearly a need that impacts all mothers, all families, all children should be using this. And I'm just curious how you're thinking about how people will get access to this extraordinary digital platform and how you're thinking about it scaling and how people will be able to touch and get access to it.
Yeah. So from a business model perspective, I always came out of the gate being like, this needs to be a B2B solution because of the value that I understood working for a large hospital system, not even being like they didn't get reimbursement for my services at all because the systems weren't in place to empower them to do that in a way that was scalable. And so coming out and saying, okay, we're going to look at these states that have, high birthing populations, looking at Medicaid reimbursement, that is really a large opportunity to get at these patient populations where nutrition for high risk, at risk pregnancies isn't universally available but hasn't been scaled unity because nutrition reimbursement state by state is not really black and white. And so if we're coming and we're saying, hey, we're going to grow in this state, we're going to launch with a large hospital system, we're going to gather the data for that patient population to show that, yeah, nutrition is valuable in a way that hasn't been done before when it comes to continuous care, home monitoring for nutrition, 24/7 support from a dietitian, gathering that data in a way that makes sense for healthcare systems and doing it in a culturally relevant manner can be really valuable for taking that information and going on a state by state basis and saying, here are the MCOs, here are the Medicaid opportunities in that state on top of what is already available through private pay insurances where these reimbursement codes are available and hospital systems are leaving them on the table. It is unrecognized revenue right now because, as I said before, getting to that nutrition reimbursement is in black and white. And to be honest, nutrition reimbursement is minute compared to reimbursement for doing surgical procedures or doing other things. And so it's not prioritized in the hospital system. We're saying, you partner with Mother of Fact. Your patients love to talk with us. We are providing care that's tailored to their environment and tailored to their cultural background. And we can do it in a way where you're tapping into unrecognized revenue that is cost neutral at minimum and on average is 2x over what we cost to bring into your hospital system.
Wow. And one of the things that's so apparent here is how many of the health moonshots that we're focusing on you touch. So there's obviously women's health and maternal health. There's our food as medicine moonshot, where I think this has so much relevancy. It's also something that goes upstream from our diabetes or cardiometabolic or other health moonshots, where if people get access and use this solution, it ends up preventing some of those health issues downstream. So I think that's really extraordinary in terms of how you're thinking. What states are you focusing on to start? And then you mentioned health systems you're trying to meet. There's different types of clinics that you work with. Who should be reaching out to you to be working with you? And there's obviously a vast audience that will hear your story and be listening to this. And I want to make sure we're connecting the dots here, because I want more systems, I want more clinics, I want the right people to be knowing about what you're building. By the way, I love the name, Mother of Fact. It's just a wonderful name. But what states are you focusing on first? And maybe you have several. And then who should be connecting with you in if you were to wave a magic wand?
Yeah, great question. I have a very simple answer to that, and it's a product extension we just launched. It's called the Maternal Nutrition Impact Estimator, and we've taken the data that we have seen through our patient and clinical interactions and said, here's the return on investment if you bring on digital first nutrition services such as Mother of Fact. And what happens is these clinical leaders, so women's health line leads, OBGYNs, women's health residents, nursing staff, community organizations that are serving this patient population, they can go in and they can say, I'm in this state. This is the number of births that I have per year, can put in insurance breakdown, and we take our data algorithms and spit out the return on investment that they could be seeing compared to what they are doing in nutrition care currently, which could be I have a 1 day a week dietitian that works with my gestational diabetes patients, or we only refer out to outside dietitians and we don't see any reimbursement or we don't see any data from that. And from that, no matter what state they're in, we are taking that data and giving it back to them to say, yes, your state reimburses for medical nutrition therapy under Medicaid, because not all states do. And yes, this is your patient population, and this is the amount of return on investment you get from the revenue, from the public health standpoint, and from outcomes improvement as it relates to health related outcomes, but also staff efficacy related outcomes. When we know that OBGYNs, staffing changes are happening, and we want to make sure that we are empowering them every step of the way instead of adding burden to what they are doing. So if anybody is interested, just go to our website, motheroffact.com, and hit contact us, and we will send you the link to that maternal nutrition impact estimator. And they can kind of do their own sleuthing with data that hasn't really been available before related to nutrition services that are continuous and effective, and patients are actually engage with more than one time. We are launched in 4 states, working to get to 7 by the end of the year. But again, that estimator is what we have built because it's not black and white for nutrition reimbursement. And to have something out there to show the path of the value of nutrition to save moms and babies, right? Everyone wants to do that, but impacting clinical care from a wholesome perspective.
I'm glad you mentioned that, and I want to double down on that. So, regardless of where you are, where your system is, I think having that type of tool with the estimator is a great way to start, because you can start to understand the impact and the benefit right there, then maybe that'll be the impetus for more quickly expanding into to new states, which I would love to see this all over. Walk me back a little to the genesis of how you envisioned the need for this, the solution for this. I'm so inspired by how you're approaching this. I've long been, I know how I grew up, and I was so always so grateful to my mother of prioritizing nutrition. I think decades later, I'm benefiting from the amazing foresight that my mother did for our family in terms of feeding us with certain types of foods. And I don't get sick as much, and there's all these benefits that I have. But what was the genesis for you? How did this come about?
Yeah. Yeah. Back in 2020, before the pandemic, I was working as a dietitian and managing nutrition clinics around the Boston area and doing really awesome work. We were doing home visits, we were seeing them on the specialty clinic and seeing moms at work, but I couldn't scale it. And at one point, I actually had a baby die on my caseload, and I was the last clinician to see them at their home. And the fact that this happened wasn't because we weren't good at our job. We were really good. I got to them too late. And it came down to a case of looking at what happened and saying, we need to scale what we're doing. Staffing a dietitians is expensive. Like I said, the reimbursement per unit is not great. But I know that getting out to more families in a culturally congruent way and working with them in a continuous manner works in preventing things like gestational diabetes and preeclampsia and, weight gain that is too much or too little, which then leads to C-sections, NICU stays, and, maternal deaths. 1/3 of maternal deaths are directly related to malnutrition or lack of nutrition care. And so at that point, I was on my third maternity leave and said, let's build a business, and became a tech founder like any normal person did. And over the next couple of years, I really built it looking clinical first. What is going to be most helpful for the clinical ecosystem, because we have to integrate. We cannot be an external marketplace for nutrition. We still have to do the legwork on paying for it and still have to do the legwork of finding a solution. Nutrition needs to be incorporated into the medical home. And so that's where that focus has been. And through working with our early healthcare systems, really developed a protocol to get into systems very quickly, make sure patients are onboarded at the right time, as early as possible in pregnancy or fertility planning, keeping them engaged and getting that data back to the healthcare system. And this past year, my little girl is 4 months old now. When I was pregnant, we grew the team, doubled the size of the team and brought on additional 2 clinical contracts. I raised money and was doing this all while I was re-engaged in the system myself.
Wow.
Really seeing that maternal care has not really changed in the last 20 years. Now, my oldest is 10. So for me, the last 20 years, but looking back at where we're going, where there's more maternal deaths now than there were in the 1950s, we're really not making progress. And so this past year has been really reinvigorating for me, not only tackling all that while being pregnant, but also looking at the system and reliving it to say, wow, we have this service that we're already activating into the maternal care workflows. There is so much more that we can be doing with this, and just being super excited to get it out to the broader clinical world. And I think you mentioned earlier, like the pathway. Yeah, we're in with healthcare systems and kind of doing hospital enterprise sales right now to get to revenue, to get to that data. But channel partnerships are coming down the yellow brick road for us, where these organizations who have remote patient monitoring and other diagnostic capabilities recognize that we are never going to get to a place where a bot can answer nutrition questions or empower a family. We need that clinical dietetic medical nutrition therapy on an individualized basis to really move the needle with nutrition. And that's where Mother Effect is. We're scaling that, using our technology and bringing in the knowledge of our dietitians.
I love that. You mentioned the theme I want to double tap on. Used the word culturally relevant a few times in the conversation. I'd like to understand that a little better. My father and one of my sisters lived for a couple decades on the Northern Cheyenne Indian Reservation, and I've spent a lot of time there personally. And there's a whole other just relationship with food, and there's different challenges with diets there, and food deserts are a big thing all over the country in different places. And then different cultures have different relationships with different types of foods, obviously. How have you designed for that? How do you think about that? And I'm so happy to hear that seems like a cornerstone of how you've architected this solution very thoughtfully. I'm curious to learn more about that.
Yeah, there's lots of different touch points where we need to be doing what we call like culturally congruent care. And so it comes down to access and looking at digital health equity, digital health literacy when it comes to accessing those patients and making sure universally we are doing that in a way that is equitable. So when we think about languages or when we think about how we're talking about nutrition and food, there's a lot of stigma around doing that within many different conditions or general daily living. And so making sure we're communicating that in a way that we are here to empower you. We call our clinicians best feeding friends, and really meeting them where they're at from the get-go, from that referral, and then bringing them on, doing it in a way being like, what do you want? Where are you coming from? What is important to you? And that brings in the whole realm of social determinants of health and backgrounds in eating and food. And then building on that, instead of coming from the diagnosis standpoint and being like, we are using nutrition to treat diabetes. We are using nutrition to treat high blood pressure or anemia. We're coming at it from the other lens with clinicians who come from that background. Look, working in Boston, working with Haitian Creole families, we had really good relationships. Would they prefer to work with a dietitian that looks like me? Probably not. So also working to increase that diversity in the background of the clinicians and where they're coming from, because that only elevates that trust and that understanding for these patient populations. And then I think the third thing is when we're thinking about elevating our machine learning and how we're bringing AI into the picture is using data sets and looking at our data in a way that is inclusive of different cultures and races, so that as we're pulling together this new data that's represented or being analyzed and disseminated in a way that is equitable, but also relevant to how care needs to be shifting in the United States when we think about women's health. Those were three really broad buckets, but I think what differentiates us from other services and how we're doing that, but also doing it in a way that is integrated with the clinical care system, because we know that patients are out on the internet looking for nutrition every single day, but we need to make sure that information is being cycled back to the medical home so that all that information is not contradictory and also super helpful for the patient and clinician at every single point. So, and then I think another way we differentiate ourselves, right, is bringing in that clinical value and making sure that we are highlighting that and not working as an outside system on top of, I don't know the right way to say this, but like on top of the healthcare system, but we are a channel partner. We are a white labeled service per se, so that we can elevate clinical care that is already going on. We are not out in the community doing a separate movement.
Or integrated
Yeah,
in, which makes
we're
so much
more
sense.
integrated. Yeah.
Last question. What are you most excited about? How are you seeing things progress? And if they are, but I'm curious how you're feeling from, say, 2021 till now, or even when you started your career and your journey to where you see things going, what's giving you hope and optimism? Where also it seems like a more macro sense with the Maha movement and other movements, there's more of a focus on nutrition in general. I'm just curious how you feel and what your lens is and what's giving you the most optimism today and where we are.
Yeah, the most optimism today. I think when we look at what's going on with the MAHA movement and some of the shifts in healthcare right now, like you said, nutrition is a highlight. Where the opportunity is, Unity, is how to build trust within the patient populations as that shift in focus is going on. And what we're seeing with social media and some of the differentiating advice related to nutrition, there is a need for a leader in women's health to step up and say, I am an unbiased source of information that focuses on the individual patient first with evidence-based information in a way that's going to elevate their health and bring that forth in a way that patients can understand, but also is super valuable for government policy and healthcare systems. That gets me super excited because we need that right
Yeah.
now. We need that. And so, and I think the way Mother Effect delivers our services, yes, we are a clinical service doing medical nutrition therapy using technology, but the other half of our business is that data we are gathering from those patient populations who are receiving new guidance, who are being affected by insurance coverage, where Medicaid access might be changing. And so because we have that plethora of data, that gets me really excited to tackle it on both sides and what we're building out from a technical capacity, where dietetics kind of has been lagging in what's going on with technology advancement and data for many years, or else I don't think we would be here. And I love my dietitian pals and the organizations that I've worked with for several years, but I'm excited to step up the game. And our tagline, wildly different nutrition care, I think hits the mark. We want to be wildly different and, meet families where they're at.
Emily, thank you so much for bringing this to life, bringing Mother of Fact to life, and for the mission that you're on and the work that you're doing. I want more people to know about this. I want more systems and clinics to know about this so we can get this out to the world. This is helping a lot of people. So I just want to thank you. Where can people get in touch with you? Where can people contact Mother of Fact? Obviously, the domain name is Mother of Fact, motheroffact.com. Is that where people should go? Where do you want me to send people?
That is where people should go. We have a contact us page right there. I'm also really active on LinkedIn right now with everything going on in women's health and nutrition information and what I'm building as a founder that is also living the experience as a mom of four right now. So I'm on LinkedIn as Emily Sylvester. So that would be where they can find us. And we love informational conversations with anybody that is working in women's health, specifically if they work with these patient populations and are passionate about nutrition care, but don't necessarily have a clear pathway to get there.
Well, I was hoping I'd hear your new little one coo a little more because it's the best sound in the world and so beautiful and inspiring that and amazing and impressive that you juggle all of it. You're just absolutely extraordinary. Thank you for everything you're doing to push this mission forward. Thank you.
I appreciate your time. Thanks so much.
Bye.